The following program is brought to you by the Center for Educational Outreach at Baylor College of Medicine.
Hello, my name is Susan Bloomfield, and I am a professor in the Department of Health and Kinesiology at Texas A&M University in College Station. I'm also an investigator in the National Space Biomedical Research Institute and serve as an associate lead for the musculoskeletal alterations team in NSBRI. I'm happy to be here today to talk briefly about what are some of the key issues with bone loss that occurs during space exploration. Before we begin, I wanted to share a few definitions that would be important in understanding some of the upcoming material. Most of us think that bone is bone and it's just where it is. All right. However, if you look at this illustration, I'm going to be referring to two different types of bone that are important in this discussion about how spaceflight impacts on this material. What you see is a breakaway illustration of the femur, the longest bone in our body, and the mid part of the bone, the long shaft of the bone, is made of what we call cortical bone, what most of us think of as bone, a hard mineralized material. It does indeed have cells embedded inside and on its surfaces in the living animal, but that's what most of us think of when we think of as bone. If you look at the top end of that femur, however, you'll see that inside there's this lattice work in the top end of the femur, in the head and in that area that's labeled spongy bone. And that's the layman's term for what I will be calling cancellous bone. That lattice work of bone is more metabolically active and is preferentially affected during certain conditions, such as bone loss after menopause with estrogen deficiency, as well as with the disuse or the unloading that astronauts experience in space. This lattice work of cancellous bone is found in the ends of the long bones in our body, as well as in the spinal bodies, the vertebral blocks that make up our spinal column. So I will be referring to some changes that are specific to cortical bone and some specific to cancellous bone. I might also refer to some specific bone surfaces. The outside of the long shafts of our bone, or the external surface of any area, actually is called the periosteal surface, which takes its name from the connective tissue layer covering the bone called the periosteum. The inside edge of the long shaft of bone is called the endocortical surface. And again, different things happen on different surfaces, so that should give us the background we need to proceed. Well, many of us know about some key factors that are important in maintaining normal bone mass. And we talk about bone mass because it's an important predictor of how likely a bone is to fracture. And bottom line, a bone's function is not to fracture and to provide good support for our musculoskeletal system. Well, to maintain normal bone mass, we need, of course, a normal hormonal status. Many people are aware that after menopause, women lose their circulating estrogen and experience an accelerated period of bone loss as compared to normal age-related bone loss. We also need good nutritional intake. Most people are aware that calcium and vitamin D are important to good bone health. It's also important to maintain a normal energy balance. If one is chronically short on caloric intake, that as well can impact on bone mass and bone health. Many people have heard that you need a minimum of weight-bearing activity. A little bit more exercise on a daily basis is even better. But most of us maintain reasonably normal bone mass as long as we're standing up, walking around, and incurring a minimum amount of activity every day. It's also important, as possible, to avoid other specific causes of bone loss. For example, alcoholism and certain medications can impact negatively on the maintenance of bone. Well, In the rest of this talk, I'm going to be focusing on one factor in particular that pertains to spaceflight conditions, and that's the weight-bearing activity component. And this is what changes dramatically as soon as a crew member enters zero gravity during spaceflight. Well, this slide illustrates the basic problem. There's rapid bone loss that occurs once a person is in space for any period of time. These data were derived on mere cosmonauts who spent at least 4 and as long as 14 months in space aboard the Mir station. And the graph illustrates the percent change in bone mineral density, our most common measure of bone mass, incurred per month. And you'll notice that there's very little change in the arms, a little bit more in the whole leg bone. But if you look at some bone sites that are rich in that cancellous bone I referred to, the femoral neck, the spine, the pelvis, and what we call the femoral trochanter, which is also in the proximal femur near the hip, we see a change of anywhere from 1 to almost 2% change per month. Now that doesn't sound like a whole lot. However, let's put it in context. This red line illustrates the typical rate of bone mineral density change in a postmenopausal woman per month. So you can see that in those cancellous bone-rich sites, the rate of bone loss is almost 10-fold faster during spaceflight as during a period of estrogen deficiency. This is really rapid bone loss, and it raises concerns about the risk of fracture in these individuals once they transition back to normal gravity on Earth. Now, we don't lose only bone mass or bone mineral density, but there are interesting changes in the cross-sectional geometry of bone that are also important to bone strength. These 3 ovals are meant to represent cross-sections of the femoral neck. Okay, it's that tube of bone that leads into the hip joint. And this is an important site to study because this is the site where hip fractures occur. Well, on the left, you see an orange oval representing the cortical shell of that femoral neck. And in life, that white area is actually filled in with that latticework of cancellous bone. Well, after some months in zero gravity without any weight-bearing activity to speak of, you generally see a thinning of that cortical shell. So what happens is that you get activity, increased activity of bone resorbing cells called osteoclasts on that endocortical surface, on the inside of that cortical shell. And so you have a thinning of that cortical shell over time. So that the figure on the far right then represents what an astronaut's femoral neck might look like in cross-section at the end of a 4 or 6 month stay aboard space station. So you can see we have that thin cortical shell. There's also actually a small increase in what we call cortical porosity, small resorption sites, microscopic resorption sites within that thick cortical shell that also reduce its strength. And then we also lose mass of the cancellous bone in the center of that bone. So we have several factors contributing to a potential loss of bone strength, of structural strength at the femoral neck. That raises concerns about fracture risk once that crew member returns to Earth. Well, let's look at the current exercise regimen that astronauts pursue while they're aboard the International Space Station. You may be aware that they are required to exercise anywhere from 1 to 2 hours per day, using both aerobic exercise modes, as pictured on the left, with a crew member harnessed into the treadmill aboard space station, but also with resistance exercise. The picture on the right illustrates an astronaut performing resistance exercise using the first generation of equipment aboard space station for this purpose. The general presumption has been that with the combination of these exercise modes, and particularly with resistance training, which on Earth has been shown to maintain or even increase bone mass in normal, healthy individuals, that these astronauts would be able to maintain or at least mitigate the loss of bone mass during these long-duration space flights. And indeed, this training has been reasonably beneficial and effective in preventing losses in cardiovascular fitness and in mitigating the loss of muscle that we see during spaceflight. Well, this next slide illustrates some very intriguing data collected by Tom Lang at University of California, San Francisco. 14 ISS crew members agreed to perform CT scans before and after their missions. And we're very grateful for their participation because this has yielded incredibly important information on several levels. The first graph illustrates, again, a percent change in bone mineral density per month at several bone sites. And you can see that we are still observing a decline in this, what we call now, volumetric BMD from CT scans each month that these individuals are in space. The most severe bone loss, again, is observed if you isolate that cancellous bone that we talked about, that latticework of bone that's more metabolically active. So that site on the far right is just cancellous bone inside the femoral neck. And you can see over a 2% loss per month. The second graph represents data based on the first graph. Engineers have developed some smart estimations of structural strength of the femoral neck and also for the lumbar spine based on their cross-sectional geometry and the bone mineral density. And you can see here that these engineering estimates of strength in both the spine and the proximal femur are declining 2 to 2.5% per month. Well, the reasonable person would ask, well, is this really significant? These are healthy, high-fit individuals. Does this really have clinical significance? Well, those data, the CT scan data, were then subjected to a more sophisticated engineering analysis called finite element analysis, which does a voxel by voxel analysis using both the mineral density as well as the location in space of that particular voxel. So by combining both the mineral density effect and the geometry effect, engineers can come up with a much more precise evaluation of the strength, the structural strength of the femoral neck. Well, the results were pretty impressive. Joyce Kiak and her collaborators, including Tom Lang, computed that the average strength loss in the ISS crew members who helped us with these important CT scans was roughly equal to 50% of the strength loss seen over a lifetime of aging in the average Caucasian woman. And in fact, those individuals who had the largest losses in bone mineral density or the largest changes in bone geometry approached the strength loss, 100% of the strength loss seen over a lifetime of aging in Caucasian women. And most of these crew members were male, and given that men tend to lose less bone mineral density in toto over a lifetime, these are probably underestimates of the strength loss as compared to a lifetime of aging in Caucasian men. So you can see that there's reason for concern that this level of bone loss might significantly increase fracture risk for the average crew member. There are a number of factors yet to be determined in this story about bone loss with spaceflight. Investigators with NASA and the National Space Biomedical Research Institute are investigating whether bone fractures will heal normally in the environment of microgravity. Many of you who have experienced a broken bone, particularly in the leg, know that your orthopedist encourages you as soon as possible to use a walking cast. Weight bearing and the physical forces incurred on that bone with weight bearing actually do help the healing process. And initial data indicate that the fracture callus that's formed as part of the normal healing process is not optimal if that bone is not weight bearing, using ground-based models that we have to study this. Secondly, we are just beginning to gain information about the additional impact on bone of exposure to the very low level but somewhat constant radiation called galactic cosmic radiation that astronauts are exposed to during extravehicular activity on the shuttle or ISS. They will also be exposed to this radiation during lunar outpost missions once we progress to that phase. The radiation exposure during solar flares is a much higher intensity, but is much more rare. So it's important for us to gain information about what is the impact on bone, particularly given preliminary data from investigators like Ted Bateman at Clemson University that indicate pretty dramatic effects on cancellous bone in particular of this low-dose radiation. What we are just beginning to get information on is what's the combined effect of non-weight bearing in addition to that radiation exposure. And lastly, we are just starting to get a handle on the question of whether once this bone strength is lost after a prolonged period of non-weight bearing or the disuse of microgravity, can it return? Can bone mineral density be regained, and can those geometric changes be compensated for once a crew member has returned to Earth and resumes normal weight-bearing activity? There's good indications that the bone mineral density will eventually return, but we still need much better information about how those geometric cross-sectional shape changes return to normal. There are various methods we have to study these changes here on Earth. As you can imagine, there are very few and limited opportunities to gain the kind of data that Tom Lang and his collaborators did on astronauts who are actually exposed to microgravity. So to speed this process, NASA and NSBR investigators actively and frequently use this model pictured here. If you put a normal healthy human on strict bed rest, in other words, you're not out of bed for any reason for anywhere from 30 to 90 days, we see a number of changes in the cardiovascular system, muscle, and bone that mimic very well what we see during spaceflight. This takes very dedicated subjects and very dedicated staff, and is rather expensive, but gives us incredibly important information on a much shorter time frame than waiting to accumulate enough astronaut data to answer key research questions. There are also a number of small animal models that we use here on Earth to answer questions that we either cannot address in human subjects or to generate data in a more timely fashion. Pictured here is a model my laboratory uses that we call the lunar mouse. The mouse pictured here is in a harness system with part of its weight supported. And indeed, its weight can be titrated to whatever we choose, but in recent studies we've titrated that weight bearing to 1/6 body weight, which mimics very well the weight bearing you would see while on the lunar surface. This model was originally developed in the labs of Dava Newman at MIT and Mary Buckstein at Harvard, and has great promise for advancing this area, particularly for studies such as radiation exposure that we simply ethically can't do in human subjects. Now, there's a lot of relevance of these data for human health issues here on Earth. Certainly, the astronaut corps is an important population, but it's a very small population. And there are thousands to millions of individuals here on Earth who suffer bone loss due to various causes, but sometimes to disuse itself or non-weight bearing. There are many clinical patients, including some elderly who are on prolonged bed rest, recovering from severe illness or injury. Ironically, the standard treatment after hip fracture is bed rest, which tends, with its non-weight-bearing condition, to aggravate bone loss, which of course is part of the underlying problem. Individuals suffering spinal cord injury certainly experience the most severe form of disuse that we know here on Earth and lose a large amount of bone mass in a short period of time and are at much higher risk for fracture. There might be strategic interventions that we can develop with knowledge gained from these NASA and SBRI-funded studies. Rehabilitation from prolonged disuse is another relevant area, and gaining some of the knowledge that we are pursuing in investigating the role of exercise countermeasures during spaceflight might well be relevant to a number of populations suffering from osteoporotic bone loss. Even though the underlying mechanisms are slightly different, a lot of the same principles in regards to weight-bearing effects on bone may well apply. Well, thank you very much, and do remember to keep exercising and walking for those bones.